This scar is a constant reminder whenever Vicki Bailey gets the urge to light up a cigarette. It's from a life-saving surgery, heart surgery, for a problem detected during an eye exam. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Almost everything connects right back to your heart. In fact, it's the theme of our show every Thursday. Today's guest is a perfect example because she had a potentially deadly series of blockages discovered by her ophthalmologist.
I try to get in as much exercise as I can, and I'm real lucky and real fortunate to be here to tell you about it today.
After all she's survived, one of the toughest parts of recovery for Vicki Bailey has been forgiving herself.
I don't have a lot of sympathy for myself for smoking for 53 years.
She is acutely aware of how close she came to not being here anymore.
It could have been over any moment. If I ever want to smoke or whatever, I look down at my chest and say, well, don't need to do that again. So I've never had a puff since that day.
For Vicki, that day was her surgery day, during which doctors performed major surgery on the 4 crucial arteries meant to supply blood and oxygen to her entire body, including her brain.
I think I was more scared afterwards when I came home and read all that stuff that they had done, and it, just almost makes me cry.
But with all the attention on everything happening in Vicki's chest, you might be surprised to learn it was an eye doctor who first realized that Vicki was in grave danger.
Lo and behold, I didn't put 2 and 2 together, but anyway, doctors did.
It began when Vicki started noticing a vision problem in her right eye.
What I describe it as is kind of like a cotton ball that you could not see through.
She made an appointment with University of Kansas Health System ophthalmologist Dr. Radwan Ajlan, who ordered a series of scans.
Look right and look to your left.
What those scans revealed was alarming. 1 week later, Vicki was in surgery.
It still just overwhelms me emotionally to think that they saved me.
Doctors say the vascular problems that nearly killed her were likely caused by smoking. So with this second chance at life, Vicki is taking nothing for granted.
My main goal in life is not only to not smoke again, ever, is to take care of this new bionic body they gave me. I have an obligation to myself to stay active and to watch the salt and the sugar. I'm more responsible for the way I feel than I've ever been.
And when it comes to self-forgiveness, she's working on that too, with a sense of humor.
I might as well forgive myself, or I can have enough guilt that drive me crazy and give me a heart attack anyway. At the minimum, a fever blister.
We are so pleased to welcome Vicki Bailey to our program today. How are you doing this morning, Vicki?
Feeling great. Thank you.
We are so glad to have you here. And we also have her ophthalmologist, Dr. Radwan Ajlan, and her thoracic surgeon, Dr. Todd Crawford. Thank you both for making time to be here. We know you both are super busy. Vicki, first off, thank you for sharing your journey with us. How are you feeling heart-wise?
I don't feel a thing. It's great. Actually, really good. It's amazing what they did. But I cut my hair off because my right arm would get so tired. And now I can let my hair grow back out because my arm is no longer tired.
That's what I was going to ask you. So before all this, you'd had extreme fatigue in your right arm. Did you recognize that as a possible heart symptom?
No.
It's just your arm?
I just thought I was getting older.
Right. We hear that so often.
Yeah.
So did you notice a major change then? Once you had recovered from the surgery, was your arm completely back to normal?
Yes.
Wow.
Yes. After recovery, but recovery took a little bit, but evidently I handled it pretty well, because I don't know how long it was, but showering was hard, but I could wash my hair.
And before you couldn't use
it just would be so tired. If I had to work above my head, I mean, I'd have to stop and shake it. And I guess I should have thought about that means blood, you know, but
Well,
everything needs blood, you know.
you know, as you're saying that, and I'm asking, did you notice the doctors are saying, yeah, because it's probably common. People don't recognize these symptoms. Dr. Ajlan, how do you break the news to your eye patients that you're seeing something very alarming in their eyes and you have to send them straight to the emergency department? How do you do that without frightening them?
Well, sometimes, well, it depends, right? So it depends on the patient and how are they receiving the news. You wanna show them that you really care about them. Sometimes you wanna tell them it's really serious and you need to go to the emergency department today. So, and if that caused them to be scared a little bit, you just comfort them and make sure they get there. So sometimes they need to feel it, otherwise they will not think it's important and
The
they
urgency.
will not go.
Vicki, do you remember your first feelings when you were told you've got a problem, a blockage, you need to go to the emergency department?
Yes. I wanted to do a whole head, neck, and chest scan. And I said, well, let's, you know, go ahead and do that. And so we'll have something to talk about when I come in. And
Boy, there was a lot to talk
yeah,
about.
and they got all this stuff scheduled, and the scheduling nurse called me back. And after I read some things about how urgent it was on my chart, I went, you know, the next day I says, you know, we better just make that appointment as soon as we can.
Right.
And changed my mind. So,
Thank goodness.
yeah.
So I want to talk about your diagnosis with Dr. Crawford. Dr. Crawford, Vicki had something called innominate artery stenosis. How would you explain, is it innominate or innominate?
Innominate.
All right, I said it right.
Or brachiocephalic. But
How would you explain it to someone without a medical background?
yeah, sure. So, you know, the role of the aorta is to deliver blood to all the vital organs in our body. And when the blood gets pumped out of the heart, the first branch of the aorta, if you will, are the coronary arteries, or first branches. And, you know, those are small vessels that deliver blood to the heart muscle. But beyond that, the first major branch off the aorta is the innominate artery, or the brachiocephalic artery. And that delivers blood to the front right brain, as well as to the right arm and the back of the right brain.
So if you're just facing the camera, where is that on your chest? Can you point to where that is?
Yeah, so it's actually high up. It's towards the neck.
Okay.
And then this is where the aorta in the front of the chest turns and goes down the back. And that first branch off going towards the right side is the innominate artery.
And that was blocked?
Yeah, hers was completely obstructed. And so the manifestations, she was showing the vision changes and the right arm weakness, which we call claudication, are fairly classic findings for innominate artery blockage, because blood is not only compromised to the brain and then the retinal artery, which, you know, is part of the eye, but then also to the right arm.
Was your arm swollen at all?
No.
So the only thing you had was weakness?
Mm-hmm.
Wow. So Dr. Crawford, you shared with us 2 images of Vicki's heart before her surgery. We've put those up on the screen. What do these images show?
Yeah, so the picture on the right is probably the easiest to interpret, but there we're looking from the side at Vicki's aorta, and then the first branch, which is the innominate artery. So you can see screen right, that is her back, that's her spine, and screen left, you can see her sternum in the front. And then we use contrast to light up blood vessels, so that lighter gray on the left side, that is her ascending aorta, and then the bright white, which is the same density as bone, is actually calcium buildup. So the way our body responds to trauma or plaque buildup in the wall of the artery is to calcify. And so you can see this very dense calcification right at the origin of her innominate artery.
So the bright white is the bad stuff.
Exactly.
That you have to somehow get out of there. Which brings us to this. 4 of Vicki's crucial arteries had blockages. Let's take a look at what you removed. What are we looking at here?
Yeah.
Wow.
Yeah, so it's not every day you get to see this, but on the left, that is actually a picture of her innominate artery. And so you can see at the bottom of the screen there where the vessel looks relatively healthy, and at the top where the lumen, or the inside of the artery, is completely obliterated by this calcific plaque. And then on the picture on the right, that's her ascending aorta and the beginning of her arch, which was removed at the time of surgery.
Vicki, is it weird?
Yes,
those?
quite
First
weird.
time you've seen those?
Yes.
That looks like a lot to remove from someone. So what do you put in its place?
Yeah, so we use a tightly woven polyester graft. Kind of describe it like the sail of a ship. And
that's the bionic part that Vicki was talking about.
Exactly.
Your
I
new
had no
bionic
idea.
body. Yeah.
But yes.
Wow.
These grafts are gelatin impregnated to prevent future calcification, and they've had a lot of modifications over time.
What are those? Can we put those pictures back up? Because I just want to know, what do they feel like when you touch them?
Yeah.
Are they hard? Are they rubbery?
Yeah, so the normal artery does feel rather rubbery. It's muscular, but it's typically fairly elastic, and you can deflect it and move it around as you would like. When they are calcified like this, it feels like a rock. It feels like you're touching a rock, and it's not mobile, and so we have to be very careful working around that so that we don't dislodge any of that plaque, which could then go on to the brain and cause a stroke.
So the parts you removed feel like two fossils.
Exactly.
Just brittle. We mentioned Vicki is one of countless patients that you have referred to you from ophthalmologists like Dr. Ajlan. What a team. You also shared some other images with us from other cases. This is an image of what you removed from another patient. What's that?
Yeah, so this is a similar case as Vicki's. This is, again, innominate artery stenosis, and so this is demonstrating what, when we open that vessel on the inside, it looks like. And typically you would see 10 to 12 millimeter channel that's wide open, and here it's completely obliterated. There's no lumen in this innominate artery.
So that should be a hole. Like you should be able to see
Be
through.
wide open.
So that yellow stuff is the plaque.
That is the calcified plaque.
How big is that, say, compared to a nickel?
Oh, it's probably about the same size, or at least it should be.
Wow. And is this diagnosis usually found during eye exams? Do you typically have people come to you because of an eye exam?
Increasingly, they can be referred for one of two reasons. One would be changes in their vision, like Vicki experienced, but the other thing that sometimes brings them in is what's called rest pain or claudication in their right arm. And so anytime they move their arm or exercise it and that oxygen demand comes up, they steal blood from the back of their brain to try to supply blood to that right arm, but it's not enough, and so then they get an ache because they're not getting enough oxygen to the muscle.
Did you have an ache? Just weakness or an ache?
It ached.
It ached.
Yeah.
Okay.
And fatigue and
Right.
achy, and it's kind of hard to describe, but you got it.
Yeah.
And so, Dr. Ajlan, when we come back to the eyes, to Vicki's eyes, we have two images from an eye scan. Let's put those up on the screen. What stands out to you in this image?
So this is Vicki's scan when I saw her the first time. So she came, this problem has been going on for Vicki for about 8 years or so.
Wow.
And it was like people were trying to figure out what was going on, and she showed up with an eye inflammation and eye problem. So beside the eye exam, we can see here the blood flowing inside the right eye, but normally the dye, which is the white part in the arteries, usually it fills all towards the end, till the periphery. In her case, we can see the arteries end short before they reach the end, like on the other side, on the left side of the screen.
So is that white blob to the right, is that?
That's the nerve.
Okay.
And you have like the arch of the blood vessels, one up to the left and one down to the left, and also to the right side. The dark spot at the center, that's the center of her vision. It looks perfectly fine. But if you look to the far left, the arteries don't really fill through. They end up too soon.
You don't see the white little.
Exactly. They don't
tentacles
go
going
to the
out.
end. So that's what was challenging, because she still had the good vision. So we're catching it before that I go blind. So that was the really very rare to see or catch earlier. Maybe I have, in 8 years, I may have seen 1 or 2 patients like her.
And so you saw that and you knew there was something going on
Something
with her
didn't
heart?
look right.
Right.
So I'm like, okay, so we did a bunch of other tests, and then like, you know what, I think it's probably a blood flow issue.
Oh my gosh.
She had other stuff in the eye that she needed to see comprehensive ophthalmology, other general ophthalmology doctors. So I sent her to my colleague, and I told her, this is what I think she needs, and we need to take care of that. And that's all.
We have a second image that you also shared with us that I just want to put up. What's that an image of then? Is that the same eye?
It's the same eye. So usually you see the blood flow, and that like the first image was around like a minute or so.
Right.
This is like approximately 9 minutes later, and the periphery didn't fill completely. Like the far left, it's still not completely filled.
Right.
Usually when I examine this, I really zoom in the screen. So, but it confirmed my suspicion.
How urgent was this in the moment?
Because she had good vision and it has been going for a longer time, I didn't need to send her to the emergency that day, but we got her really quick with my colleague, and then we got the process going. So here at KU, we're all interconnected. So okay, I need this to be done. Can we take care of it? One of my colleagues told me, yes, we took care of it. So I know she's in good hands.
Well, that's what is incredible. Go on.
And that's exactly when he sent the message over to Dr. Joel Biggs, the vascular doctor, that something needed to be happening because there's no blood. You know,
right.
You guys say it so well. But anyway, and that's within a week after he was notified that I met Dr. Crawford.
Right, because you and Dr. Joed Biggs work closely together.
And Dr. Downey was also the lead surgeon on that operation too.
It's a whole collaborative effort. I just love when I can have a program like this where we have an eye guy and a heart guy, and most people, I wouldn't think that those are connected until we started doing this program, and then to have you working so closely together to save people like Vicki.
That's why I went to the eye doctor, because it was an eye thing.
What were you experiencing in your right eye that made you go to the eye doctor?
Well, I had some trauma back about 2015 or 16 into the right eye, and my right eye has always been a little bit, difficult with my vision or whatever. But after I got Medicare, not Medicaid, Medicare, good insurance, I went with all KU doctors, and I says, I need to have this checked out because it was severe trauma, and I had been treating it, basically self-treating myself with the proper drug, but not the right doses. So it was a steroid drop.
The trauma that happened to your eye, did you get hit in the eye or something like that? So if you hadn't been hit in the eye, would this have not been discovered because you wouldn't have been going to the eye doctor?
Possibly, I guess. I don't know.
Oh gosh, that's scary.
Yeah.
So this has been going on for 8 years. How much longer did Vicki have to let this go untreated?
No, that's a really good question. We know these processes take time to develop, just like any blockage in the body. And they're heavily related to some behavioral habits, smoking, for instance. The studies about innominate artery stenosis, the incidence of smoking is almost 100%. It really doesn't happen in the absence of that. And it's not plaque buildup like we think with high cholesterol levels. It's a different kind of insult from the tobacco smoke over time. And that's what leads to the plaque formation and then that development of the calcium occluding that lumen or the opening of the vessel. So this happened over many years.
Yes.
Now the urgency of it is purely related to symptoms. So what are those symptoms? Well, some patients start to develop what we call monocular blindness, or one eye, and it kind of goes in and out. It feels like a curtain coming over the eye. And what that can
the cotton ball that Vicki described?
Yeah, and what that can signal is those pieces of plaque are breaking off, and then they're going into the artery to the eye, the ophthalmic artery. And that, when that starts to happen with increasing frequency, then we have to move faster.
And that's what was starting to happen. We have some great questions that are already coming in. If you have a question or a comment that you'd like us to share on air, send it to us right now on YouTube, Facebook, or the All Things Heart email. You can find all the ways to connect with us in real time right there on your screen. We're going to give you a moment to get those questions in. Vicki, I want to get to the smoking component, which you quit cold turkey. You were a smoker for 53 years. How did you quit cold turkey? Was that incredibly hard?
It was pretty easy after waking up and recovering. I mean, granted, it was still a challenge, and I did do Chantix to help for some of those urges, as I got better and better and moved around more often. But
explain what Chantix is to our viewers who don't smoke.
I don't know. What is it?
Is it a patch or a pill?
Oh, no, it's a pill.
Okay,
it's
a pill you're taking to...
And it helped with the anxiety,
cravings.
I think, maybe more than anything. But what I found, and what was most challenging, and especially to be in Kansas City, was the barbecue. I had to stay away from barbecue because it was such a trigger. And food is a trigger in general, speaking
Right.
with smoking, you know, after a meal or whatever. And
The
but
smoke from the barbecue?
not smoke from
Or
the
what was
barbecue,
it?
but the fatty meats and the taste in my mouth. I had to, you know, refrain from eating it for a while, a long while, because it just was a trigger to smoke. Y'all wouldn't understand that, but
Interesting.
but
Boy, that's a lot.
It
One, to
was.
quit cold turkey, and then two, to stay away from barbecue in Kansas City.
yeah, that's a lot.
That's huge. Dr. Crawford shared some other really interesting images. We do want to alert our viewers, if you're squeamish, you might want to close your eyes for a moment. We'll let you know when the images are off the screen, but close your eyes now if you're squeamish, because here we go. We want to show you Vicky's heart. Dr. Crawford, walk us through what you did here to open the blockages, and at what point of the surgery was this image taken?
Yeah. Yeah, so this is after the reconstruction has been done, and I wish I could zoom in a little bit, but essentially what you see there is that bright white material. That's our polyester graft. And down near the heart, which is the yellowish pink structure in the center of the screen, you see one limb come off that then branches multiple times. And so that limb is now taking blood up to the left carotid artery, the right carotid artery, and the right subclavian artery. So the disease in her innominate artery was so extensive that it was right up to where those two vessels branch.
Wow.
And in order to treat the entire innominate artery and its branches, we actually had to sew individual grafts to the subclavian artery and the right carotid artery.
Vicky, I should have asked you, are you squeamish? Too late now.
Yeah.
You're looking at it. Was this the first time you saw this
Yes,
too?
yes, yes.
That's got to be so
It's amazing.
fascinating. And what a vulnerable position, such trust to have your chest wide open. Well,
The
this guy,
alternative, you have to
Yeah.
trust, because there isn't much alternative left, you know.
right.
So
Wow.
it's just amazing. It's flooring.
The science is
Yeah.
incredible. We have a video as well. So don't open your eyes yet if you're squeamish. But if you're not squeamish, this is so fascinating. Dr. Crawford shared a video. Holy smokes. So this is another patient with the same diagnosis?
Yeah, this is a patient with very similar symptoms as Vicky. Hers was mostly manifesting as neck and arm pain more so than the ocular symptoms.
And what are we seeing here? What point of the surgery was this taken at?
Yeah, so this is again after the completion of the operation, and so what you see here is this large branching graft that comes off the side of the aorta. So rather than replacing the ascending aorta in this patient, we put the patient on cardiopulmonary bypass, dropped the pressure so we could clamp the side of the aorta, and that way we didn't have to stop the heart. And then we sewed this bifurcating graft off, meaning it branches into two different vessels. And one goes to the right axillary artery, so all the way out to the arm, and one goes to the right carotid artery in the neck.
You do your thing. Okay, we're going to give our tech team a minute to get that off the screen. Okay, it's safe to open your eyes again, my squeamish friends. Dr. Crawford, does smoking always cause this? Have you ever seen this in a non-smoker?
Well, it's interesting. I look back over the last few months because I've had several of these cases, and in the case reports and the studies you find, it's about 100% incidence of smoking. So you know, this is very much linked to smoking. While most of the patients I've had are women, it can occur in men and women with about equal frequency. So it's not just women that smoke, it's everyone. And then it typically happens in the 50s to 60s when these problems start to manifest.
Dr. Ajlan, we have a really nice image. It's a visual that shows our viewers just how the heart is connected to the eyes. It's a graphic. Can you take a look at this and just talk about the mechanics again when it comes to the heart to the eyes?
Absolutely. So this is a great photo. So we see the direct communication. If you see, I'm sure Dr. You, like the cardiothoracic surgeon, will have a better explanation. But as an eye doctor, I can tell you. So if you can see the two red lines in the neck, those are the carotid arteries, and you see when they branch, and the one to the right of the screen, that branch, there is a branch that goes to the eye. So it's a very small vessel that goes to the eye.
It's all connected.
Exactly. And the beauty of the eye is like it's the only organ in the body that you can look inside it and you can see blood vessels without cutting through the skin. so you can see it directly.
What was the name of the exam that you gave, Vicki, that you're giving these patients that you're able to detect this?
So we do a dilated fundus exam. We look
Okay.
inside the eye, and the test that we showed, it's the fluorescein angiography. That's what we did. We basically inject a dye in the arm in clinic. Our nurse do it and take photos for 10 minutes and review it with the patient on the spot.
So I've been to the ophthalmologist, never had any dye injected in my arm. Is this something that people should be requesting to see if they have a heart problem?
So the physician will request it if
Okay.
they need it. So because it's an invasive and you inject a dye in the arm, so we don't do it on everyone unless you really need it, because there is also a rare risk of having a reaction to the dye test or an allergic reaction.
We already have some really nice questions coming in from our viewers, so let's get right to those. Gretchen has a question for Dr. Ajlan. Gretchen writes, I'm a 50-year-old non-smoking woman, normal BMI, I work out, but I had 2 retinal hemorrhages in the periphery of my eye 2 years ago. This year I had 5. What would be the cause, and should I be worried? My dad is fighting off glaucoma with drops right now. I know that's a lot.
No, it's a good question. It's a common question. So I will say, get your eyes checked by a retina physician, or we're happy to see you here at KU. We need to figure out why you're having those bleeding spots. Bleeding spots in the eyes are not normal. It can reflect something wrong with. It can be something like diabetes. It can be blood pressure issues. It can be cardiac. But from the description, she needs to have an eye exam and make sure nothing else is going on. If the patient is on other medication or have other medical conditions, they might contribute to that.
Follow up, she says she had blood work done to check her vascular health, and that came back perfect. I know you don't treat her, you can't, but should she continue this on?
We need to figure out why is it there. So
Still keep digging.
Mm-hmm.
Okay. Jean Reardon has a question. Did these blockages show up on a PET scan?
So those are really small, like those blood vessels are like almost as thin as a hair. So you cannot see. If it's a big blood vessel, like yes, but I'm not sure that the best scan is a PET scan or a CT angiography. So that's why we collaborate. It's as long as it's outside the eye.
Right.
But if it's a vascular or cardiac, I ask the cardiothoracic surgeon.
What would be your answer to that?
Yeah, so her blockages showed up on a CT angiography, so a CAT scan where we actually administer dye that
Got
then
it.
lights up the arteries so we can see those blockages.
Jean has a follow-up question. Was that an ache in the arm or chest? And was your eye aching? I believe you said it was just your arm.
Yes, just
And-
my arm. Yeah, I had no chest pain, and then the vision problems. So
Which you attributed to that eye injury you'd had
Right,
a while back.
right.
You didn't dream it was connected
no,
to your
I didn't,
arm and your
not
heart.
at all.
Victoria Crawford, that's your wife. She wrote, "Hi, we love you, Daddy. Case and Emma want you to wave to them." You gotta wave. Okay, tell us about Case and Emma.
They're doing great.
How old are
They're
they?
Keeping us young. So Case is 4.5 and Emma is almost 2 in January.
And you have a
And
third.
then we have Tally, who is almost 9 months.
So you have 3 under the age of 5.
Yes,
They're keeping you young and tired.
yes, they are.
Anything you want to say to Tori?
No, just thanks for watching.
Say, I love you.
Yeah, I love you.
Thanks for
She's-
letting me work so much.
She's the sweetest because we had you both on a program before. We love Tori. Jeremy has a question. Jeremy writes, I never really thought about how an eye exam could reveal so many other things beyond the eyes. What kind of other conditions or issues have you seen where the eyes revealed another problem elsewhere in the body?
We've
great.
seen a lot. So they say that the eye is a window to the body. It is really true. We've diagnosed patients with diabetes, blood pressure, and many other health issues. You look at their eye and say, you know what, you need to go and see the neurologist. You need to see their diabetes doctor. You need to see their cardiologist. And they will be wondering why. And then we keep explaining.
So keep those eye exams.
Yeah.
Never skip your eye exam. One final question from Rita Terreros. Are there any symptoms, other symptoms that appear in the eye other than what Vicki was describing?
Yes, people can go blind. And in Vicky's case, I'm so happy that we were able to catch it early and the cardiothoracic surgeons just acted on it so quickly, so that they saved her life, they saved her eye, if not her life, because if those plaques or clots go to the brain or to the eye, she may lose that eye.
Wow, and you're fine. You are doing great. We're so happy you're here.
Me too.
This is incredible. I would love to get some final thoughts from all three of you as we wrap up this discussion, which has been fascinating. Vicki, I want to start with you. What would be your message to people watching who might not think it's important to get an eye exam?
Good question. I think I would just say, make good choices and good decisions in life and promote your life that, for goodness, not for, self-indulgence. And, take care of yourself, because I was a lucky one. These guys took care of me.
You're taking very good care of yourself right now. What do you have planned for next year? You have any big plans?
Yeah, I do.
Yeah. You want to share
Wake
them?
up every day.
Oh, just keep living a good life.
Yeah. Just keep doing what I'm doing and getting stronger and stronger, because I do feel like I'm still almost recovering, because I think I realized that was a bigger surgery than I even thought. And yeah, just to keep my husband from bringing home more treats.
That's
a hard one.
What's your husband's name?
David. Hey, Dave.
David,
don't bring home any more sweets.
Bring home vegetables. Vegetables. Dr. Ajlan, how unique is it to have such a close working relationship with a cardiothoracic surgeon?
Well, I'm fortunate to have them working with us and other specialties. This is the beauty of KU. Like when I have a patient here, I can look at their cardiothoracic notes, I can see at their other medical conditions. So it's one health system taking care of the whole patient as a whole. So it's a wonderful experience.
And Dr. Crawford, it must feel really good to both you and Dr. Ajlan to have such a phenomenal patient who is completely on board with the plan to get her healthy. What a difference that makes.
Oh my gosh. That's exactly what the point I was going to make. It takes a lot of courage to undergo an operation like this. High risk of stroke, we have to shut off blood temporarily to major vessels that go to the brain. And Vicki demonstrated tremendous courage in that. But what I think makes her the most courageous is the ability to quit smoking after 53 years, because that's a commitment to wanting to live longer. We know that we're treating a manifestation of the smoking, but without smoking cessation, we can't provide that long-term cure like we'd like to. But you've demonstrated that commitment day in and day out.
Thank you.
Very proud of you.
And just another note on the smoking is there was many times I thought about it, or you see a half a cigarette laying on the street and you're going like, ooh, and it's not without temptation or being around a smoker, but it can be done, and I don't actually have any urge or any temptation at all to smoke now, and it's been just about 13, 14 months since the operation.
That's remarkable. And how strong. 53 years. That's way more than half your life. That's most of your life.
Yes. Most of my whole adult life.
Yeah. So I hope you know how incredible you are.
Thank you, gentlemen. And all of those that come with you. And I'm glad I had KU as a whole for my care.
Yeah.
And they still do.
You sure do.
Yeah.
Well, thank you for taking time to share your story. And doctors, thank you so much for taking time, because I know you've got to go do a surgery. You have to go see more patients. If you would like to share or watch any of our previous episodes, just scan the QR code that's on your screen right now. It'll take you to links of all our previous shows. You can watch them, you can share them, you can post them. Coming up next week on All Things Heart, some doctors call this the fourth quarter binge, which is why we're telling Vicki's husband, don't bring home any more treats, bring home vegetables. There are parties, and more holiday parties, and there's drinking more than usual. We're going to show you what just a single night of drinking more than usual can do to your heart. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update, Jill Shahan wanted info, options, and answers. Anything to help her understand her breast cancer diagnosis. And she found it in an old friend. I'm Jessica Lovell on the next Morning Medical Update. The reunion that completely changed Jill's path to survivorship, plus the surprise moment that led her to Arrowhead Stadium. Friday at 8.